Hi and welcome to this video where we'll talk about anatomy and physiology. We'll start this presentation with appendix. Appendix is a small tube located near the junction of small and large intestine. You can see the red point here. This is where the appendix lies. In our body, it's on the right lower quadrant of the abdomen. And the function of this we do not really understand right now. However, this part may get inflamed, which is called appendicitis, and if it bursts open, it can really cause infection in the body. Next is aorta, which is the largest artery in the body. It transports blood from the left ventricle to the rest of the body, helping with the systemic circulation. Arteriole. Arteriole is a smallest kind of artery in our body. And then we have artery. Artery is the vessel that helps carry blood away from the heart and helps in circulation throughout from head to toe. Atrium. Atrium are the two upper chambers of our heart, which can be a right atrium and a left atrium. The right atrium receives deoxygenated blood from the body. The left atrium here receives oxygen-rich blood from the lungs. Automaticity of heart. This is the ability of heart to generate and conduct electrical impulse on its own. Autonomic nervous system, which is a part of central nervous system. This is the division of the peripheral nerves that controls involuntary and voluntary muscles in our body. Bladder. Bladder is a round sac-like organ of the renal system, which is used as a reservoir for urine. Blood pressure. Blood pressure is the pressure which is caused by the blood exerting force against the wall of blood vessels. It is usually the arterial blood pressure is measured. There are two types of blood pressures, diastolic and systolic blood pressure. Brachial artery, the artery in the upper arm, in the site of pulse, and this is where we check pulse for CPR during an infant, when it is given to an infant. Bronchi. Bronchi are two large set of branches that come off the trachea and enter into the lung. These two. There's a right bronchi and left bronchi. Calcaneus, which is the heel bone, you can see here. This is the outer heel where the skin tissue is, and this is the bone here. Capillary bed, which is the connection between artery and vein. This is where a lot of gas exchange happens. It's a thin-walled microscopic blood vessel where oxygen, carbon dioxide exchange and nutrients get dropped off and the waste gets picked up. Cardiac conduction system. This is a system of specialized muscle tissue that conducts electrical impulse which stimulates the heart to beat. It is also connected with the brain and other parts within the heart. Cardiac muscles, these are the specialized involuntary muscles which are only found in the heart. Cardiovascular system, which is made up of heart, liquid or blood, and the vessels that helps transport the blood, whether it's oxygen rich or deoxygenated blood. Carotid arteries. Carotid arteries are the thick arteries that are present in the neck, which helps transport blood to the head. Carpals, if this is the impression of left hand, just the base of where the fingers start, that's where the wrist bone, which is also known as carpals. Central nervous system, which is made up of the brain and brainstem, as you can see in this picture here. The clavicle bone, which is also known as collarbone, you can see that in the red. It's the first longitudinal bone at the beginning, just below the neck. Coronary arteries, these are the blood vessels that supply the muscle of the heart. As you can see, very thin wall, and this is where usually coronary artery disease develops, and this is what gets plugged, and they get plugged and the blood circulation is affected. Cranium is the top, the back and the frontal side of the head, of the skull. Cricoid cartilage, this is the ring-shaped excuse me, the ring-shaped structure that forms the lower portion of the larynx, and we'll learn more about larynx in the coming slides. Then dermis. Dermis is the second part of our skin. The topmost layer is the epidermis, and then we have dermis, and then we have fatty tissue or subcutaneous layer. Diaphragm. Diaphragm is very important for respiration process. It is a muscular structure that divides chest cavity from the abdominal cavity. As we're talking about diastolic blood pressure, this is the pressure in the arteries when the left ventricle is refilling or when the heart is at rest. The digestive system, through which the food travels through, and the body's in the body, and it gets broken, digested into absorbable forms. Dorsalis Pedis, it is just a fancy name for an artery that you can find on your foot. This supplies blood, oxygen-rich blood to the foot, and it's pretty prominent. You can easily find that. Endocrine system, this is the system of glands that produces chemicals called hormones, which helps to regulate many body activities and functions. Epidermis is the topmost layer of our skin. Epiglottis. Epiglottis is a leaf-shaped structure, as you can see here, that prevents food or any foreign matter from entering to the trachea. Epinephrine, it's a hormone which is produced by the body as a medication. It dilates respiratory process or respiratory passage, and it is also used to relieve severe allergic reaction. The exhalation process, which is a passive process in which the intercostal or rib muscles and the diaphragm relax, causing the chest cavity to decrease in size and the air to flow out of the lungs. Femoral arteries, these are the major arteries that supplying the leg. As you can see, it can be very very prominent in the femur. Femur is a bone, as you can see in the picture, red. It's the upper leg or the thigh bone. Fibula, or in short fib, this is the lateral and smaller bone of the lower leg. Gallbladder, this is a sac of the underside of the liver that stores bile produced by the liver. Humerus is the bone that you can find in the upper arm, which helps join the shoulder and elbow. Hypoperfusion, as you can see the hypo means low, perfusion means exchange of gas. Hypoperfusion can also be called shock or low in pressure. Ileum is the superior and widest part of the pelvis. Inhalation process, in which we breathe in, it's an active process in which intercostal muscle and the diaphragm contract, expanding the size of the chest, and it causes the air to flow into the lungs. Insulin, it is an hormone which is produced by the pancreas. It can also be taken as a medication, and these are different devices which are usually used to deliver insulin to a diabetic patient.